This presentation is about tapeworm infection in cats. Tapeworms are a flat segmented intestinal parasite that commonly infect cats and dogs. As adults, they can reach lengths up to 30 centimeters. They have mouthparts shaped like hooks that attach to the side wall of the small intestine, which allows them to stay inside the small intestine and develop. The most common species of intestinal parasite in house pets is Dipylidium canium, which belongs to the family Cestode. Dipylidium tapeworms can infect humans, but it requires the ingestion of an infected flea, so infection is more commonly seen in children. There are other common forms of tapeworm belonging to the groups Taenia and Echinococcus. Taenia tapeworms infect mice, birds, and rabbits, while Echinococcus tapeworms also infect mice, but are more commonly seen in foxes and coyotes. Echinococcus tapeworms can also infect humans, and the infection causes potentially fatal diseases, but transfer of the tapeworm requires human exposure to an infected rodent. Tapeworms are made up of several small segments, and periodically the tail segment will break off. These tail segments are called proglottids and are filled with as many as 20 tapeworm eggs, all the size of a grain of rice. In this scenario, the eggs are ingested by a flea larvae, which develops into an adult after about 2 weeks. The infected flea is then ingested by the cat, and the tapeworm eggs within the flea are released into the small intestine where they hatch and develop. This cycle continues until the infection is diagnosed and treatment can be administered. Cats suffering from tapeworm infection will exhibit unpredictable appetite and possibly some irritability. They may suffer from seizures, diarrhea, and in very rare cases they may be seen dragging their anus across the floor. These behaviors may be seen in the cat, but they are not guaranteed and vary depending on how intense the infestation is. The physical signs of infection also vary. All cats suffering from tapeworm infection will have proglottid segments that are released in their feces. This is also the most common way of diagnosing tapeworm infection. Less commonly, the tapeworms can be seen moving in the anus, or they may be released in the vomit. If the infection gets too bad, they will cause the cat to exhibit a gait or even weight loss that may at first look like weight gain. Tapeworms are treated by deworming medication and anthelmintic that takes form as a tablet for at-home treatment and injections for veterinary treatment. In cases where reinfection occurs frequently, the cat should be administered regular flea control or prevention treatment. Thanks for listening.